Hello, my name is Antonia Williams. This is September 19th, 2019, and I'm here at Colorado Christian University. I will be presenting to you my questions that I asked in the interview with the health administrator here in Prescott, Arkansas. The title is Healthcare Reform Questions and Answers. The questions I asked her was, how does healthcare reform affect pre-existing conditions? What if I don't want insurance? What will happen with my children's insurance once they're older? What about illegal immigrants? Far as pre-existing conditions, how does healthcare reform affect those with pre-existing conditions? The reform doesn't affect them at all. Why? Because in 2014, insurers was no longer legally allowed to deny coverage to anyone because of their medical condition or charge them more due to their medical condition. And I felt like it was pretty fair. What if I don't want insurance? Other than just asking what if I don't want insurance, the better answer is, why wouldn't you want insurance? When you don't have insurance, additional amount on taxes will be added and the medical costs are very expensive. You really wouldn't want to pay out of pocket for like serious surgeries, different doctor's appointments, even just normal checkups. What about my children? If my children get older, most insurances or some insurance will start to take off the insurance of the children before they're 20, 21. So most of them stop at about 18. Well, with the Affordable Care Act coverage, it covers until the age of 26. And then after that, that's when they pretty much do all of that on themselves. What about the illegal immigrants? Are they covered? They have to be legal in this country for coverage. She stated that if they're not here legally, that they can't be covered because it's a lot of requirements that are needed to be met before you can be granted the coverage for the insurance. And a lot of people knows that. That was all of the questions that I was able to ask her. It was 4 of them. Sorry that, I didn't get many more. If I had more time, I'm pretty sure I would be able to get more questions from her, but she was very busy and I was very pleased that she was able to step out on short notice to answer my questions. What did I learn? Health conditions does not matter. That you can still be covered and get approved for coverage. That insurance is very important. Without insurance, other than taxes, the medical costs could be very, very expensive just paying out of pocket. I've been there. The children are covered, not only because of the Healthcare Affordable Act, they have CHIP. That's also a reform that covers children, low income families, and all of that. And I learned to be knowledgeable. I have to be proficient with what I am determining to be as a health administrator. I have to know these things. I have to understand all of the requirements that it takes to be a health administrator and what it takes to get people approved for insurance, how important it is to talk to people about getting insurance and making sure they're covered, their kids covered, their families are covered. It's very important. And to stress the issue that health conditions doesn't matter because you have elderly people that doesn't have insurance, not only because they can't afford it, because they fear that their health conditions will automatically deny them for it. So that's what I learned, and I hope you all enjoyed this short presentation and that the information I provided was enough. Uh, um, I'm very camera shy, so God bless and thank you.